After having a baby, times can be hard and it might be difficult getting to the doctors, but Denver Health and Family Connects can help you right in the comfort of your own home.
In today's sponsored segment, we're joined by Mia White, the supervisor of nurse home visits, to tell us more. Thank you so much for coming to GDC, Mia.
Thank you so much for having me.
This is great. I love this. Let's jump right in. We heard that Denver Health offers a special program for new parents, 3 in-home visits from a nurse after delivering a baby. I got to tell you, having my first baby, I have 2 now, that is such a help. Can you tell us more about this program?
That is a response we get from everybody. Yes. So the Family Connects program started in Denver at Denver Health about a year ago now. What this program is we will come to your house, send a nurse to your house for anywhere from 1 to 3 visits. We're going to check in on mom, baby, the family, see how everybody is doing, dad, whoever else is there, the other kids, everything.
That's right.
And yeah, just see what the needs are, see how everyone's doing and what we can do to support and help and reassure that you're doing great. This is, everything is good. This is hard and exciting.
What a great program. What a help.
So why are these in-home visits so important, especially in those first few weeks and maybe months for a newborn?
Absolutely. These visits are so important. We're going in around that 3-week time, which is kind of right between those initial visits that babies have when they first are discharged and coming before mom has her first visit. So we're kind of catching people right in that in-between time where things are really changing. People have a lot of questions. Is this normal? Is this not? And being able to just come to somebody's home, meet them where they're at, provide that reassurance, and connect with other resources, connect them back to Denver Health, whatever it is that they might need.
What are the nurses helping out with? I mean, having gone through this, I know specifics and my own things, but each family goes through something different. What are the nurses helping out with when they're in their home?
Absolutely, yeah. So it can really range. Something that's really important for our whole team is that we're addressing what the parents' needs are, what that family's needs are. So it's not going to look the same for everybody. What we are able to do is do a full health assessment and exam on baby. We can make sure that their weight gain is still on the right track. We help a lot with lactation and breastfeeding, kind of coming up with plans and helping people feel more comfortable physically with that. Figuring out childcare, kind of planning into the future, helping older siblings adjust, and I've helped a family give their baby their first bath before too. So really can kind of range depending on what
Karen,
it is.
I don't want to cut you off, but I did have a question that something we dealt with and we didn't know early on. Are you there and do you notice any sort of postpartum symptoms while you're there that early?
I appreciate you asking that. Yeah, that's a big part of kind of this program and how this program started is we saw that sometimes just one visit can have such a huge effect on postpartum depression and anxiety. So being able to check in that time, we've been able to get people connected back into the clinic or into more emergent services when there is something going on that we're able to address there. Yeah,
so important. So what kind of feedback have you heard back from families?
We have had overwhelmingly positive feedback. So it's been really, really a wonderful experience, I think, for our team and for our families too. A lot of people that we're seeing, it's their second or third baby, and what we're hearing is, I wish that you were here. I wish that this existed when I had my first baby, just really, really grateful to have somebody coming into the home where you don't have to bundle baby up and get out and leave and everything. Somebody just comes to you.
Speaking of bundle up, how about the good old swaddle?
Yes.
I used to do mine so tight.
Yeah.
You'd still get out of there.
They're kind of magical in that way. Yeah.
Oh man, I thought I was so good. He's never getting out of there, and all of a sudden he's out. Where can people go for more information?
So we have a Denver Health website, and we also have an email address, so familyconnects@dhha.org, and ask your provider if you're going in for prenatal visits, and they should be able to provide some information too.
Great stuff, Mia.
Such great stuff. So important. It's so important, especially for first-timers.
Absolutely.
Thank you so much. To get support on everything from feeding and sleeping to child care options, all in the comfort of your own home, visit den.health/newborn-visit, or you can connect through email, familyconnects@dhha.org. That's dhha.org. Thank you to Denver Health for sponsoring this segment.